Hi, my name's Gareth and I'm the medical herbalist here at the Wild Sage. So we've been asked to do a couple of videos and we're going to put them on YouTube and Instagram on different health concerns, and tonight's one really was to do with hay fever season and allergies. There's been quite a few people coming into the shop just asking, is there anything that herbs can do to help with their allergies? Specifically this summer has been quite heightened sensitivity to the pollen count. Usually the answer to that is yes, there's an awful lot that herbs can do, and particularly if you suffer from mild symptoms, herbs can usually solve and alleviate those symptoms quite well. If you're a moderate sufferer of hay fever, then usually they can alleviate the symptoms, and if you have quite a heightened allergic response to allergens, then usually herbs are used alongside allopathic medicine, and we would be looking at a longer term strategy to address the sensitivities both in the digestive tract and treating you holistically. So I realise that whenever it comes into allergy, there's a lot that you could be talking about, but I just want to give you a quick rundown as to the immune response and to give you a familiarity as to what a herbalist might be trying to address. So the immune system itself is actually really complicated. And there's an awful lot of medical terms and names given to different parts of the body and different cells and according to their function. And I don't want to get bogged down in the details of that, but it is important to know that you have both an innate and an adaptive immune response. So they are the white blood cells that are produced in the bones. Your B cells are produced in the bones, and that's your innate immune response, that you have that and it's active from the moment that you're born right up until your dying day. And then the other one is the T cells. So the T cells are also created in the bones, but they spend a little bit of time in a boot camp in the thymus gland, where they are equipped to become aware of what might be pathogenic or alien, and really identifying what is self from non-self. And that really happens right up until puberty, at which point the thymus gland kind of stops working and those T cells all go and spend time in the lymphatic system, so in the lymph nodes, where they will be released to go and identify anything that is foreign within the body and to discern what was self from non-self. Then as well really is the B cells and the T cells. And the T cells are your kind of face-to-face warriors. But they do communicate with each other. So there's a lot of talk at the moment, particularly with COVID. You'll have heard things like cytokine storm. So cytokines are whenever the cells are communicating to each other, these are released, and there's maybe up to 30 different cytokines, all with different names. But what is important to know is just about how they communicate and their function within it. Those same cytokines will also communicate with the liver, and the liver will increase an allergic response by releasing glycoproteins, and they will increase kind of inflammation in the area that the fight is starting to happen. So if you have a virus that comes into the body, a B cell is going to recognize it. It's going to realize that it doesn't belong here, and it will either consume it, break it up, or tackle it in a few different ways. The most common one, so it's phagocytosis, when they're gobbling up the pathogen, and then they present a small part of that, which is called the antigen, and they produce a small part of that protein, and they present that then to the T cells. The T cells see that, and they come along kind of one by one to see if they have the antibody that's relevant to that antigen. So they come across and they measure themselves against it, a little bit like a lock and key, until they find the perfect fit. And once they find that perfect fit, then they rapidly produce up to like 2,000 a second different T cells to be able to just as exact clones so that they can start fighting the infection. And the liver comes in to try and build up this inflammatory response by dilating the capillaries and allowing the blood plasma to enter to allow the battle to commence. And a lot of those symptoms that you recognize, like the itchy eyes, itchy nose, itchy throat, runny nose, watery eyes, can all be attached to this increase of inflammation that is being tackled. What is important is that your liver is functioning properly. If you don't have enough protein, then your liver may not be able to actually raise itself to this anti-inflammatory response. So you have questions as to if your immune system isn't active enough, then you could suffer things like pneumonia. If it is overactive, then you get into autoimmune illnesses where the body starts to fight against itself. So trying to understand that we're not just addressing the immune system, we're also going to be addressing the liver. There will also be complications there for the kidneys, because the kidneys have the adrenal glands on the top of it, and the adrenals release cortisol, which is sent out to reduce inflammation. So ensuring that you have good hormonal function, that your kidneys are working well, that the adrenal glands are working well, that you're not stressed, are all factors that a herbalist is going to take on board. Now, there's 4 different types of immune response, and you'll know that really from whenever you go to the doctors to get your blood tests taken. So you'll see IgG, IgE, IgMs, and they're all about just examining blood constituents about allergic response. And whenever it comes to hay fever, the only thing that we need to be aware about is the IgEs are responsible for our immune response and atopy, so eczema, asthma, and hay fever. Hay fever works on the basis that these T cells are supposed to be helping the B cells and to fight the infection. The T helper cells then will go and attach onto mast cells, which are the white blood cells. Now, mast cells contain histamine, and whenever a T helper cell latches onto the mast cell, it automatically explodes the mast cell and releases a bunch of histamine. So you'll know histamine because you take antihistamines for your hay fever. And what histamine does is actually across the board, it does a number of different things in different areas. So we need histamine in our body. It's in our stomach, and it's released in our gastric juices to increase our stomach acid and get the body ready for digestion. It works on the central nervous system, and it also works in this immune response where the histamine is released from the mast cells to try and increase inflammation. The difficulty for hay fever sufferers is, of course, that if it's a heightened response, it doesn't seem to ease off until you remove the allergen, and sometimes that can be quite a long haul, especially if it's over the season of the summer. So histamine is a bit similar to serotonin and dopamine, adrenaline. It's a hormone that's released into our blood system, and therefore it can have a varied response in a number of different places. The reason that whenever you take an antihistamine tablet and it causes drowsiness is because it covers a couple of different receptors on your body. So the one that we would be concerned about in relation to the immune response is the H1 receptor. But if it also covers the H2 or the H3 receptor, then you might feel a bit drowsy. So some of the antihistamines have a drowsy effect on people, and that will be because it covers those 2 different receptors. So the preference usually has been to go to antihistamines that are non-drowsy. The other side of that is, though, it could still have implications on your digestive tract, and knowing just exactly how it acts in your body is really important. In relation to things that it might cause, if you have too much histamine in your body, it'll mess up your circadian rhythm, so your sleep pattern may get, your sleep pattern could become less of a pattern, for want of a better word. You could have arrhythmia, you could have swelling and redness, the watery ducts, the itch, they will all come as a response of excess histamine. People that suffer migraines might have excess histamine in their bodies, insomnia and anxiety, that type of thing. If it's in the digestive tract, then some people might complain of acid reflux, diarrhea or stomach pains, and cramps. So obviously a full case history is really important to be able to discern whether or not it's a histamine problem that you're dealing with, or whether or not it's another hormone such as estrogen, or perhaps it's something just completely different and it's an idiopathic illness that needs to be addressed through the case history. Within the musculoskeletal system, then, histamine can cause joint pain, muscle pain, fatigue, and also cramps. It's broken down by a process called methylation, and there's a couple of different things, enzymes that are involved in that. So DAO is one of the main enzymes that's used for that, along with another SAMe, which is there to try and help the breakdown of histamine. So if you don't have enough DAO in your body, then you're not able to break down the histamine fast enough. If that continues as a cycle, then the histamine's building up in a cyclical pattern over a piece of time, and all of a sudden you get to this inflammatory response that doesn't seem to be calming down in any way. Added to that, some foods have quite high amounts of histamine. So if you have a histamine rich diet, such as cured meat and pork, shrimp, that type of thing, then actually that can raise the amount of histamine in your body and would heighten your symptoms during hay fever season. Another food that has a real strong affinity with increased hay fever symptoms would be alcohol, and that's because it inhibits the DAO from actually being produced to break down the histamine in the first place. So it's not so much that your histamine levels are built up, it's that the DAO is not being produced to actually break it down in the first place. There's a lot of talk about people who would try and take histamine out of the diets, and I think that's maybe good short term for people who have severe allergies. But the difficulty is it's a really difficult diet to stick to, and it's bland, it's not interesting. And so one of the things I feel is that we have been given creation and food to enjoy, and I'm definitely a believer that something else has gone awry in our system, and it's not necessarily food's fault. I am an advocate of things that are organic, and I do want to make sure that your liver function is good, that you're clearing all of the histamine from your body as best you possibly can. But there are some foods that you would do well to avoid, especially just at this time of the year. So citrus, strawberries, anything that has sulfites, so red wine, pineapple, can all stimulate the release of histamine within the body. Other things just to keep in mind, so whenever you have too much histamine, it can have an impact on your skin, so the capillaries dilate and become leaky. There's flushing, you can have hives, eczema, it can become itchy skin, you can have a swelling of the lips and watery eyes. The respiratory system can be affected too, so you can have a shortness of breath, you can have the feeling of just closing over of the esophagus to the point that you feel you can't breathe and you have an anaphylactic shock. Stress can affect it, so if you are too hot or too cold, or if you're dehydrated and you don't have enough water, then you can raise the amount of histamine in your body. So those are things that you would want to monitor and keep in check. Histamine-rich foods maybe to consider avoiding or reducing during this season. Alcohol would be up there as a number one food. Fermented food would also be something of a no-no at this time of the year. Dried fruits, particularly anything that has sulfates in it, so apricots come to mind. So courgette, spinach is another one that would have it. And processed and cured meats or shellfish are all high in histamine. Anti-inflammatory tablets, so if you are on buprenorphine, then it would also be considered as something that can activate the mast cells and release histamine, so it raises that bar of histamine within the body. Things that may be helpful then, so in relation to supplements, and the B vitamins, we would be looking at a complex B supplement that just ensures that the methylation cycle is working well and that you're able to break down any of the hormones that can exacerbate the symptoms of hay fever. We would also be recommending things like zinc. So it is both pro-inflammatory and anti-inflammatory. And zinc can affect the skin, the gastrointestinal tract, the brain, the central nervous system, and sexual function. And it's estimated that quite a lot of the Western world can be zinc deficient. I think the WHO says that the World Health Organization has about 25% of people are zinc deficient in developing countries. Although that said, although we're eating the foods that may have zinc in it, we live in a depleted state. So the fact that we're not eating organic and that we have fertilizers that are all competing on our central nervous system and our endocrine system means that we are quite likely to be deficient in zinc. And certainly if you are a young guy it's just gone through puberty, there's a lot of zinc in any semen, so if you have been expelling a lot of semen, then you're quite likely to be zinc deficient. Vitamin D is a good supplement to be able to take, partly because of bone metabolism, but also because it works on the B and T cells. There are receptors for vitamin D, kind of creating this microclimate of immune defense within the blood and within those cells. So it's kind of a local hormone regulating immune function. Melatonin is helpful for the sleep cycle and can actually lessen the histamine response. Selenium is in Brazil nuts, so having some Brazil nuts every day, just 1 or 2 Brazil nuts would be enough for to have a maximum amount of selenium in your diet. Toxins that we would want to address as herbalists would be aluminium, is in quite a lot of things. Mercury would need to be addressed, and BPA, which is in quite a lot of the plastics. So making sure that you're not cooking in microwavable or processed foods. There's a lot of talk about Th1, Th2 responses within the immune system. And to be honest, it really comes down to a sense of imbalance. So it's Th1, Th2, and Th17. And that there are some herbs and foods that can be specifically prescribed to help people if there's an imbalance one way or the other. I don't give an awful lot of time to that because I feel that it's much better that we get the immune system back into balance. So looking at herbs and particularly mushrooms that will bring balance to the immune system and actually equalize both the Th1 and Th2 response are probably a much better way to go and less specific. A couple of other things that herbalists will do is we'll have a look at the drug history because any kind of medication that you might have been on could have exacerbated the symptoms, and we'll also look at exercise. So exercise is a funny one because exercise is proven to increase histamine within the body. So obviously we want to be able to do exercise, but if you're not hydrating enough, if you're not taking enough water, then there is a danger that the histamine levels are building up and you're leaving yourself wide open. And maybe marathon running through an open field of pollen isn't advisable at this time of year. Perhaps open water swimming would be a better approach. In relation to supporting the liver then, so we want to ensure good excretion, and we want to ensure that estrogen and histamine are being broken down and not being reabsorbed. So things like milk thistle and dandelion root would be things that herbalists would recommend. In relation to the digestive tract, so quite often if you have the mucous membranes are porous, the mast cells and the T helper cells all sit on the lymphatic tissue on the mucous membranes. So what we want to do is maybe just coat that and give it an added level of protection. So things like marshmallow root or slippery elm, any kind of mucilage would be really helpful to try and reduce the sensitivity towards any of these allergens. I talked a little bit earlier about mushrooms, so they're particularly useful. Reishi mushroom would be one of the ones you'd recommend in relation to an immune balance. As for herbs, the key herb for hay fever and for any allergic response from a Western herbalist would be nettle. And nettle was historically always used as a blood cleanser. And it is a blood cleanser in that it does have iron in it and an awful lot of vitamins to ensure the good nutrition, but you would need to take quite a lot of it to be nutritionally useful. But the great thing about nettle is that it works on the H1 receptor, which we talked about a little bit earlier, and is involved in this allergic response of hay fever and for asthma and for eczema. And what it does, it stops the mast cell from releasing the histamine in the first place. So it contains also some histamine which will sit on the H1 receptors to stop the inflammation being raised, but it also has this ability to stop the mast cells from releasing the histamine that they contain. So it's a really important one that can be used both in the diet as a soup. It can also be taken as a tea, and it appears about 2 months before hay fever season really kicks in. So there is an opportunity to go and pick the top 6 inches of nettle and start storing it so that you're able to get your system into place, that it's not going to be sensitized to any of the allergens coming its way. It's not drowsy, and unlike some of the other medications such as antihistamines, it doesn't cross the blood-brain barrier, so the molecules in it are too big to cross the blood-brain barrier, so it's not going to have any of the drowsy impact or affect the central nervous system in the sense that some antihistamines may do. It's anti-allergic and it's anti-inflammatory, so nettle's a really useful herb to take for that. Albizia is another one that's an anti-allergy, and it also affects this mast cell response and the release of histamine. And it's perhaps due to its effect on the histamine release and also the cytokine expression of the antigen that's activated in the IgE cell. A couple of other herbs then that would be beneficial. Chinese skullcap, Scutellaria bicalensis, is a really good herb that has been used against allergies and inflammation for centuries. And Chinese medicine never had a break, unlike Western medicine, so there's really good evidence that that has been used in both allergies and for hay fever as a mast cell stabilizer. A couple of other specific herbs then that Western herbalists would use. Eyebright is used both topically and internally, and it does exactly what it says in the tin. It's used to really brighten the eyes, so especially if you are irritated, dry, watery eyes, you can use that as a tea and just wash the eyeball. You can take it internally, and what it does internally is dry up the mucous membranes, especially the sinus area, to try and dampen down the excess mucus that is produced at the time. Elderflower is another one that will work in a similar way of breaking up the mucus and drying up the mucous membranes. And again, it's coming into the season that the elderflowers are appearing, and it's quite possible to be able to put that into the tea with some eyebright and some nettle. Marshmallow root is another herb that is used. So this is the mucilage, or perhaps slippery elm, to coat the digestive tract so that it doesn't get irritated just as fast and gives an added defensive mechanism to the mucous membranes. Plantain would be another one that's good for the respiratory system, the digestive tract, and also as a lining mucilage. Bilberry is an antioxidant and anti-inflammatory, so something that I would include. Chamomile is an anti-allergy, particularly topically, so if somebody has eczema or if you come out in a rash at hay fever season, one of the things you could put on to that was chamomile with some nettle. And what chamomile does is make the antihistamine stronger, so that it works as a supportive herb then in the process. Another herb that you won't be able to get unless you're able to come and see a herbalist would be Ephedra sinensis. So it's a Chinese herb, and it's where we would get the inhalers. It's a bronchodilator, so our asthma inhalers kind of come from the same constituents that Ephedra has, and it's good at just dilating so that you're able to get a breath in, and it will also open up the eustachian tubes between the ears, the nose and the throat, so that it clears a lot of the mucus out. So anybody that's feeling particularly inflamed or runny, that the Ephedra will help clear that system. It's a poisonous herb at high doses because it speeds up the heart and slows down the breathing, so obviously there are complications there, and that has to be prescribed by a medical herbalist. And that really is to surmise what we can do as herbalists and what you can do yourself. Nettle is by far and away the best herb you can take at this time of the year, but mixed up with some things like eyebright or elderflower can be really helpful at dampening down the symptoms. If you have any questions, you can put them into the comments and I will reply to them as soon as I possibly can. You can like and subscribe, and that would really help me in getting our message as Western herbalists out into YouTube. So thank you very much for listening. We really appreciate your support.